Ms. Stewart, you're recognized for 5 minutes.
Thank you, Mr. Chairman.
I know, it's tough to follow.
Very hard to follow that. I am known by my family to be one of the biggest crybabies, but it's for good reason. So thank you for inviting me to testify at this very important hearing today. I am Stacey Stewart. I'm president of the March of Dimes. March of Dimes is leading the fight for the health of all moms and babies. And I'd like everyone in this room to take a look at this blanket. Just about everyone that's had a child will never forget the very moment when a doctor placed a precious baby boy or baby girl into our arms, wrapped into one of these blankets. More than 700 times a year, beautiful babies are wrapped into these blankets, and one just like this one. But unfortunately, there's no mother to hold a child that's wrapped in that blanket. So that's not just a statistic. There are 700 mothers that die every single year, and over 50,000 who experience dangerous complications that could have killed them, making the U.S. the most dangerous place in the developed world to give birth. And we think, and we know that you agree, that this situation is completely unacceptable. Our nation is in the midst of a crisis in maternal and child health. Across this nation, virtually every measure of the health of pregnant women, new mothers, and infants is going in the wrong direction. The number of babies born premature is rising in this country. In many communities, rates of infant mortality exceed those in developing nations. Nations such as Slovenia and French Polynesia have better infant mortality rates than here in the United States. Women are tragically dying, women like Kira, from pregnancy-related causes and are suffering from severe health consequences like infertility. While other countries have reduced their maternal mortality rates, the number of women who die from pregnancy-related causes in the U.S. has doubled in the last 25 years. And as we've heard this morning already, Black women are 3 to 4 times more likely to die from pregnancy-related causes than white women, which is a truly shocking and appalling disparity. Maternal mortality is also significantly higher in rural areas, where obstetrical providers may not be available, and delivery in rural hospitals is associated with higher rates of postpartum hemorrhage. March of Dimes will release a report in the coming weeks that will show that maternity care deserts exist in this country, and in these deserts, pregnant women face serious challenges in receiving appropriate care. The state of maternal health in the United States is dire, but there are things we can do and we must do. Many factors are contributing to the maternal health crisis in this nation, and our work to address it is important, and it must be equally multifaceted. The bill before the subcommittee today is a critical step towards preventing death or serious health outcomes for pregnant women and new mothers. The discussion draft of H.R. 1318, the Preventing Maternal Deaths Act, would provide grants to states and tribes to help establish or improve maternal mortality review committees, or MMRCs. MMRCs are interdisciplinary groups of local experts that come together in maternal, infant, and public health to investigate the cases of maternal death, identify those system-wide factors that contributed to these deaths, and then develop recommendations that would help prevent future cases. MMRCs are unique in that they identify solutions, not just collect the data, but then identify solutions that are targeted to the needs of pregnant women and mothers in specific states, cities, and communities. The discussion draft of H.R. 1318 would also establish a demonstration project to determine how best to address disparities in maternal health outcomes. Mr. Chairman and members of the subcommittee, while this bill is extremely important, maternal mortality is not a single problem with a single solution. The causes of maternal mortality and severe maternal morbidity are diverse. They include physical health, mental health, social determinants, and much more. They can be traced back to the issues in our healthcare system, including the quality of care, as we just heard so passionately from Charles, systems problems, and of course the issue of implicit bias that exists in our healthcare system. They stem from factors in our homes, our workplaces, and our communities. Mr. Chairman and members of the subcommittee, thank you for recognizing the urgency and the magnitude of this public health crisis. Our nation's mothers and babies cannot wait any longer. We must act now to save the lives and the health of pregnant women, new mothers, and their babies. Thank you.
Thank you, Ms. Stewart.